Endometriosis. Have abdominal pain? Could it be endometriosis? Let's discuss. My name is Jana Hashahade, and today I'm going to be delivering this presentation. This is a disclaimer. I am not a licensed physician, and information provided today is solely for educational purposes. If you have any concerns in regards to this information, please consult your physician. So, what's on the agenda for today? First, we are going to be discussing what endometriosis is, followed by stigmas and barriers. In addition, we are going to discuss potential causes and common symptoms of endometriosis. Finally, we are going to be discussing the resources available. So, what is endometriosis? Endometriosis is a common yet widely unknown disorder that occurs when uterine tissue grows outside the uterus. Many women with this disorder are unaware that they have it and therefore cannot receive proper treatment. The purpose of this presentation is to spread awareness on endometriosis so that more individuals are properly diagnosed. Although there is no way of strictly preventing endometriosis, there are certain treatments available, such as reducing caffeine and alcohol intake, as well as regular exercise. Birth control is another treatment. All these treatments reduce estrogen in the body. So now I'm going to be going over some statistics regarding endometriosis. In America, around 1 in 10 women between the ages of 15 and 44 have endometriosis. Globally, endometriosis affects roughly 10% of women and girls, which is around 190 million people. In California, roughly 800,000 women between the ages of 15 and 44 have endometriosis. And in Riverside County alone, 120,000 women and girls aged 15 and 44 have endometriosis. So now we are going to clear up some common misconceptions about endometriosis. It is not easy to diagnose, and it could take several years to get a proper diagnosis. An extremely painful period is not normal and could actually be a symptom of endometriosis. Symptoms are not always present. Some women are asymptomatic. There is no cure for endometriosis, but it could be treated through medication, surgery, and hormone therapy. Not all women with endometriosis are infertile. About 30% of women cannot have children that have endometriosis. A hysterectomy and pregnancy are not cures. Good exercise and a healthy diet are good for health in general and may cope with symptoms. There are many stigmas about endometriosis, thus making it difficult to get a proper diagnosis and receive proper care. There are many risk factors for endometriosis. One risk factor is an early menses before the age of 11. Another risk factor is a family history of endometriosis. In addition, if one has irregular menstrual cycles, that could be another risk factor. Finally, being unable to conceive is a risk factor. The exact cause of endometriosis is not known, however, there are potential causes identified. Retrograde menstrual flow occurs when the tissue shed during the period flows backwards, leading to deposits of endothelial cells outside the uterus. A weak immune system causes failure to find and destroy endometrial cells. Surgical complications such as C-sections can cause endometrial tissue to be moved other places by mistake. Having high levels of estrogen can affect endometrial tissue outside the uterus, leading to inflammation and pain. The stem cell theory proposes that during retrograde menstruation, adult stem cells spread outside of the uterus and form endometrial lesions. It is important to be aware of common signs and symptoms of endometriosis so it can be identified early rather than later. Constant pain in the abdomen and lower back area, in addition to pain during intercourse, are all symptoms of endometriosis. Inconsistent menstrual cycles and excessive bleeding or spotting throughout the month are also symptoms of endometriosis. Next, I'm going to be going over some treatments that would help and what would happen if endometriosis is left untreated. There are no current known methods to prevent the development of endometriosis, however, there are many options for treating the symptoms and preventing them from becoming more severe. Hormonal treatments such as lowering estrogen levels can help alleviate some symptoms. Surgery is another option to remove tissue, but it is likely that it will grow back. Pain medications are useful for managing pain, but they don't have long term effects. There are some holistic options for treating endometriosis, such as turmeric for inflammation and acupuncture to relieve pain. If someone is experiencing infertility, IVF is also available. If endometriosis is not treated, there is a possibility of organ obstruction and painful cysts. Bowel obstruction, brain fog, difficulty breathing, and problems with urination are also potential consequences. In addition, symptoms will intensify and become very crippling. In particular, ovarian cysts cause lots of pelvic pain, heavy or irregular periods. There is also a higher risk for thyroid problems, infertility, cysts, and increased risk of ovarian cancer. So, what can one do to raise awareness in their own community? To raise awareness in the community, one can fully research the condition to understand it well. We can also educate and spread the word of what endometriosis is and how it greatly alters one's quality of life. One can also support organizations by volunteering and donating funds to organizations that support endometriosis warriors so that the movement of endometriosis awareness can be known worldwide. To support endometriosis victims and their families, one can form campaigns, donate to organizations, spread awareness through social media, support those suffering from endometriosis, and volunteer at women's health organizations. These are some resources provided in Riverside, San Bernardino County, and Coachella Valley. We would like to acknowledge Esmeralda, Alejandro, and Jacqueline for helping us guide our research. Thank you for watching. These are some additional flyers and resources we have provided in addition to our Instagram. And this is the rest of my lovely team: Serenity, Sarah, Bianca, Jeanette, and Ravima.